my name is Katie Bisordi. I'm one of the genetic counselors here at University of Maryland, and I focus in adult oncology genetics. And I will be taking you through this next section. So in the hereditary oncology setting, we have many examples of hereditary cancer predisposition syndromes having eponymous names. Here is a list of just a few examples. Now, some of these conditions might be better known by the eponyms, like Gardner and Turcot syndromes instead of FAP variants, or Gorlin syndrome instead of nevoid basal cell carcinoma syndrome. Whereas other conditions might be better known by their non-eponymous names, like neurofibromatosis type 1 or ataxia telangiectasia. Lynch syndrome is a great example of a hereditary cancer predisposition syndrome whose name has oscillated a bit over time, so I thought we could take a deeper look at this one for today's example. This particular condition is one of the most common causes of hereditary cancer risk and increases a person's chance to develop a variety of different cancers, especially gastrointestinal and gynecological cancers, but some others as well. There are 5 genes that, when mutated, can lead to Lynch syndrome, all of which follow an autosomal dominant pattern of inheritance. 4 of these genes are mismatch repair, or MMR genes, that are responsible for repairing DNA replication errors. And the EpCAN gene, the 5th one, has a modifying effect on one of the MMR genes, particularly MSH2. Lynch syndrome can go by many other names as well, and I think the most familiar other name is hereditary non-polyposis colorectal cancer, or HNPCC. But also these other names such as cancer family syndrome, familial non-polyposis colon cancer, etc., that are more descriptive of what we're actually seeing in this syndrome, namely that it's hereditary or familial, and it's associated with colorectal cancer, but not so much the high polyp rate as other syndromes like familial adenomatous polyposis syndrome, or FAP. Lynch syndrome used to be called mostly HNPCC, but now my current understanding is that HNPCC is the term mostly used and reserved for people or families who have a strong history of colon cancer, whereas Lynch syndrome is the term used when a causative gene mutation is found. So I tried to create a timeline of the condition and its naming as best as I could. It may be a bit small here, but I think you have the slides. But essentially it all started in 1895 when the seamstress of Dr. Aldred Scott Warthen, who is the chairman of the Department of Pathology at University of Michigan in Ann Arbor, she expressed her concern about her strong family history of gastrointestinal and gynecological cancers and her fear that she would also die from cancer as so many in her family had. So Dr. Warthen surveyed the family and created a pedigree, something I do every day. And in 1913, he published detailed descriptions of the first family with the disease that we now call Lynch syndrome. In 1931, Dr. Warthen died, but in 1936, his colleagues Dr. Hauser and Weller continued the work and issued a further report on the initial family. And up to the 1960s, the story had really grown cold until about 1966-67, when Dr. Henry Lynch published data from several families with clusters of very similar cancers seen in the original family. In 1971, Dr. Lynch published extensive updates on the original family and used the term cancer family syndrome in the report. And in the 1980s, kind of mid-80s, Lynch syndrome really became the name of the condition. It was then subdivided into Lynch 1 and Lynch 2. So patients with Lynch 1 had colon and rectal cancers, or CRC only, whereas those with Lynch 2 developed colorectal cancer as well as extracolonic malignancy, so it wasn't just colorectal focused. As time progressed and more data was collected on the patients and their family members, it became clear that there was a significant overlap between the two groups. And so it was then termed hereditary non-polyposis colorectal cancer, or HNPCC, to differentiate it from familial adenomatous polyposis, or FAP, which that condition, FAP, was known to present with hundreds to thousands of colorectal polyps. In 1985, Dr. Lynch first used the term HNPCC for the syndrome, and this became the accepted term for many years. Then, in the 1990s, this is a time of gene discovery, also questionable fashion choices, but in terms of Lynch syndrome genes, the MSH2 gene was discovered in 93. In 94, the next year, both MLH1 and PMS2. And then following in 1997 came MSH6 discovery. And as genetic testing and more specific classification syndromes were developed to further differentiate patients both genotypically and phenotypically, a clarification of the terms emerged. So Lynch syndrome refers to patients who have an autosomal dominant inheritance of colorectal and other cancers, secondary to a gene mutation in the mismatch repair genes or tumor microsatellite instability. Whereas patients with HMPCC, they are ones who fit clinical diagnostic criteria. We use the Amsterdam criteria for autosomal inheritance of a colorectal cancer syndrome, but do not have a defined genetic mutation as the cause. So now at this point, Lynch syndrome applied to families with causative germline mutations in the MMR or EpCAM genes. So Lynch syndrome versus HMPCC, what's in a name here? So typically Lynch syndrome is the term currently used when the causative mutation is known, whereas HMPCC is the older term used when there is no gene mutation, but a concerning and suspicious family history. Lynch syndrome is the eponymous name based off of Dr. Henry Lynch, pictured here on the slide, whereas HMPCC is more clinically descriptive name. Lynch syndrome does not really tell us anything about the condition, and I do always like to tell patients it's named this way after the doctor who described it, especially since the word Lynch can be an uncomfortable term in our language. Versus HMPCC, on the other hand, that does tell us a good bit about the condition, as we see listed here and we talked about earlier. For example, colorectal cancer being in the name tells us that the main cancer seen in the syndrome is colorectal cancer. Although all of this to say, I continue to see these two terms used interchangeably when providers and patients are talking about it, so I do try to mention and explain both names to try to reduce any potential confusion. And thank you.